This is an important message for men who've had prostate cancer surgery, who are recovering and maybe still have urinary leakage. You're probably very frustrated, and I want to help you better understand what's happening to you and what your options are. Hey, I'm Dr. James Kuan from the Sex After Retirement newsletter, and I'm a board certified and fellowship trained urologist with 20 plus years experience treating and talking to men just like you. I write a newsletter called Sex After Retirement, and it's not just about sex, it's also about recovery after prostate cancer. And one of the single biggest things that men struggle with after prostate cancer surgery is urinary leakage, or what we call incontinence. In the case of prostate cancer surgery, the incontinence that people have is what we would call stress incontinence. And that's the type of leakage that happens when you cough, sneeze, push, pull, get up out of a chair, lay down, roll over, bend, lift, you name it. Anytime you put stress or increase the pressure of the abdomen, men may leak. And there's a couple of reasons for this. One reason is that surgery in and of itself can cause weakness or damage to the sphincter, which is the control muscle. And then the second reason for this is actually a situation where there's no damage per se, but the control mechanism for urine has actually fallen out of its normal alignment. Either way, both situations result in the inability to hold your urine. It's important for men to understand that the decision to remove the prostate cancer is and was usually the right decision. For most men, they are cured after the operation. And while they did not ask for a diagnosis of prostate cancer, and they did not ask to be confronted with the side effects of treatment, the ability to remove the prostate for most men offers a single treatment that offers cure. And so while many men are cured after surgery, they're still often left with side effects like impotence and, in this case, incontinence. I see men every day who have had their prostate removed who say, gosh, I wish I should have just chosen radiation. Had I had the radiation treatment, this would have never happened to me. And I understand that frustration. And I understand that in making the decision to have surgery, it maybe wasn't an easy decision. But here's what I want to tell you. No matter how incontinent men are, whether it's days, weeks, months, or years after their surgery, there's very good approaches and strategies that we can offer. In that same scenario, I think it's also important for us to understand that making the decision was about saving your life, let's say, curing the prostate cancer. And prostate cancer was the primary goal. And while most of us have colleagues who do wonderful surgery, I understand that every time a man leaks, even if he is cured, he is reminded that he had prostate cancer. And so for me, it's some of the most fulfilling work that I do. That's treating the incontinence because I get the opportunity to restore men's quality of life to a level of function that they enjoyed before the prostate cancer. And in some ways, maybe take their mind off the fact that they ever had prostate cancer. All men are told about leakage, and they're told that when the catheter comes out after surgery, that they will leak urine. But most men are reassured that they'll be dry. And they're often given a statistic like 10 to 15% rate of incontinence. And that's often where the discussion stopped. But what does that 10 or 15% mean? If you've just had an operation and your catheter is removed, yes, we do expect that you're going to leak. If you're weeks or months after removal of the prostate and the catheter, there's a very good chance you're still leaking. If you're a year or more after removal of the prostate and you're still leaking, it's less likely that you're actually going to improve. And so when we use that 10 to 15% number, what we're actually saying is 85 to 90% of men, 1 year, yes, it takes almost 1 year for 85 to 90% of men to become dry. So what that means is at 1 year, 10 to 15% of men are still leaking. That leakage is mild in about 3/4 of those men and severe in 25% of those men who are still leaking. And so in that first year, we expect that things improve, but we do see a plateau at 1 year. And so I'm going to talk more about what happens if you've had leakage or still have leakage and it's been over a year since your operation. If you're in that case, you've probably discovered pads or pull-ups, and you've maybe found a solution that at least manages the leakage, but perhaps you're still avoiding certain things like playing with the grandkids or wearing light pants. Leakage is a problem not just because of the discomfort of the pads. There's often an odor associated with it, and then it can often cause a lot of skin irritation and rash. And so in choosing a pad, I think it's important to choose a pad that is actually meant for incontinence. Paper towel and tissue isn't going to be a good option. It often results in more skin irritation because it doesn't actually wick away the fluid. And so getting the right pad is one solution. Treating the skin and skin irritation with a barrier is another solution. I often recommend something like a zinc ointment or Penitin type cream, like a diaper rash type cream. That's going to help protect skin that's already irritated. And then if your doctor thinks that there's a fungal or yeast infection, using an antifungal can be helpful as well. But if you're at that stage just using pads and you haven't, been doing Kegel exercises, I want you to start doing that. Kegel exercises are the things that your surgeon probably told you to do. And maybe you've done a lot and maybe you're still leaking in spite of that. But if you haven't done them, Kegel exercises are kind of the tip of the iceberg. And this is that exercise that you do when you squeeze to stop the flow of urine. Doing multiple sets of these a day to strengthen the sphincter has a good chance of improving the leakage. But if you haven't done if you have done Kegel exercises and you're still leaking, and you haven't seen a physical therapist, a pelvic floor physical therapist is the specialty. These are specialists who are trained to help men with biofeedback. And biofeedback is really just helping you better understand how the brain tells the sphincter to tighten. A lot of men think they're doing Kegels, but don't. And so most of us have found that physical therapy is an essential tool. And for a lot of men, especially with mild leakage at 1 year, physical therapy is going to dry them up. But still, some men, in spite of physical therapy, are still going to have problems with leakage. And this is a little bit where, things like pads or even penile clamps. There's a device called a Cunningham clamp, which helps control the urine. And lifestyle modification, avoiding fluids, emptying your bladder before you go out. All of these things just simply aren't enough. And this is where urologists get re-involved. Urologists like me and referral to a urologist who does work like I do can be very helpful. Lots of men are never told that there are surgical options to manage their stress urinary incontinence when they cough and leak. And I think that that's just so unfortunate. And that's why I'm here to tell you that there are options. And so if you have had surgery and you've done the Kegels and you've done physical therapy and you're wearing pads and it's a year and you're still leaking and you want to improve, My recommendation is that you seek out a urologist who is familiar with stress incontinence after prostate removal. And essentially, there are two standard operations that we offer. One is the sling operation, which is for mild incontinence, and another is actually an artificial valve, which we'll do in cases of more severe incontinence. And while those terms seem very overwhelming, a sling, an artificial valve, or sphincter, what's all that? I want to reassure you that these operations are very effective and they're done as outpatients. And in most cases, when we are careful with the selection and discussion about that operation, most cases men are going to be dry. What I tell men in my practice is they will be 95 to 98% dry, 95 to 98% of the time, if I've done my job with careful evaluation and a careful selection of the right operation, whether it's a sling or a sphincter. I started the video to talk about sphincter weakness or a sphincter kind of what we call hypermobility. It moves out of its location. Mild incontinence is generally associated with what we call the hypermobility. And what a sling does is it helps the urethra and the sphincter realign back to the position where they were before surgery. This man has to be able to do a Kegel, and there has to be movement when we push on that part of the urethra for a sling to work. The beauty of a sling for mild incontinence is that once a sling's in place, there's no time to wait before we activate it. Men are dry right away. The second operation is an artificial valve or an artificial sphincter, and we do this in cases of more severe incontinence. It's like a little blood pressure cuff that we put around the urethra. And when you're out and about and moving around after things have healed, that cuff is closed and it prevents the urine from leakage. And when it's time to urinate because the bladder's full, men will squeeze a small pump about the size of the end of my finger under the skin of the scrotum. And what that does is it opens up the cuff, allows the urine to flow, and then passively, under the pressure of the abdomen, will close again, restoring dryness. And while that sounds very mechanical and complicated, it's an elegant device developed about 50 years ago that is very effective. And when we turn on this device after recovery from surgery, I get emotional every time because I know that this is a game changer in men who have had the worst leakage. And so I'm going to leave sort of a lot of the actual surgical and recovery details for another discussion. The point of this was to just simply say that leakage does persist for 10 to 15% of men after prostate cancer, after 1 year of recovery from surgery. Pads, clamps, creams for skin abrasions are helpful if this is a problem. And for many men, that's all they need. Physical therapy is vital, and if men are still leaking at a year and haven't had physical therapy, they need to see a physical therapist. And when all of that fails and you're still left leaking, seeing a urologist familiar with the male sling and an artificial urinary sphincter is probably the right next step if you want to improve the leakage. Because these operations and these treatments, when you actually have an open discussion about them, provide an opportunity for you to imagine or consider life post-prostate cancer surgery more like it was before. Maybe even better, because if you had large prostate and a lot of urinary symptoms, you went frequently and urgently, you now, when you have the sling or the sphincter, may actually find that you're urinating much less frequently with much better flow. And because of these devices, you're now dry. And so things may actually be better. Don't let the incontinence and the management of the incontinence or the failure to manage the incontinence be a constant reminder of the prostate cancer. If it is, or if you don't like the discomfort, the smell, or the irritation, or the incontinence is preventing you from being intimate and having sexual activity with your partner, I think it's really important for you to consider the next step in improving your quality of life, in your prostate cancer survivorship, and getting the help that you deserve. I created this newsletter to help men just like you to sort through topics just like this. If you liked this video and want to sign up for the newsletter, the link is in the description. It's www.sexafterretirement.com. There's an email field that you can fill. You put your email into, and that will send a welcome email. And once you receive that welcome email, you'll want to make sure that that you aren't sending these emails to your junk mail. We're happy you're here. I love having these conversations with you. Please stick around.